Today we're talking about the interpretation of lab results and diagnosing disease. So the very first thing you do when you're confronted with a lab report is to check the name, the surname and the date of birth. Many times the father's particulars are sent in lab reports, even hospital records, and it's the same surname, maybe the same name, but the date of birth should normally give it away. So check those details. Check also for the date of the collection. Sometimes it's reprints, and the reprint is the recent date, but it could be a very old report. Check the reference ranges. It can differ from country to country, it can differ from lab to lab and from test to test. So make sure that you are working in the units that you think you are working in. If there are different units, you can use the internet to do conversions. There are conversion tables, calculators, to convert it to the correct units that you're used to. Sometimes medical technology change, we've seen it with example the troponins. Make sure that you're looking at the troponin I or the troponin T. And recently we had the high sensitivity troponin, which really causes a lot of confusion. So make very sure that you read the report, you read it properly, and you look at the reference ranges. There are many drugs that can influence lab results, specifically liver enzymes. Lots of groups of medication, for example, the anti-epileptic drugs can influence all the liver enzymes. Xyloprim for gout, very commonly used, increases gamma-GT and alk-phos. All your hormones, estrogen, progesterone and testosterone can influence gamma-GT and alk-phos. Roaccutane, used for acne, can increase all your liver enzymes. It's normally monitored, and if it goes too high, the drug has to be stopped. Statins, commonly used, raise cholesterol, and it will increase the AST and the ALT. Even your non-steroidal anti-inflammatory drugs can influence your liver enzymes and increase the gamma-GT. It's normally very easy to just stop them for a while and see if the gamma-GT returns to normal. TB drugs and antibiotics can also play havoc with your liver enzymes. Antibiotics should be short duration and it should go back to normal. TB drugs normally at least a 6-month duration, so you might have a problem assessing those liver enzymes. The quality of the specimen is very important. If the cells broke up, hemolysis, that can give you false high values, LDH, AST, ALT, so your liver enzymes will increase just because the sample is old or it was too hot and the cells broke up. Cholesterol can be falsely raised and your sugar can be falsely low. If there is utilization of the glucose in the sample, it can cause a high creatinine, and that will lead to a false low glomerular filtration rate, because one of the key factors in glomerular filtration rate calculations is your creatinine. So a false high creatinine will give you a false low glomerular filtration rate. Samples that are lipemic, it's normally non-fasting, then it becomes valueless for your triglyceride reading as well as your LDL, because your LDL is derived from a calculation using your triglycerides, so that would become invalid. Your total cholesterol should not be affected by a fasting state or not. There are some conditions that are just uninsurable. There's a whole list. Recently diagnosed cancers, even your early cancers, defer them for a while. Advanced stage cancers, uninsurable for a very long time. Uncontrolled hypertension, diabetes, poor risk factor control in somebody that has had ischemic heart disease already. If there's poor documentation, that you just don't have the information, or poor follow-up, or poor compliance, that makes it very difficult to give terms. Diabetes with end organ damage, nephropathy, neuropathy, vasculopathy, retinopathy. And your ischemic heart disease would also be an end-stage disease for diabetes. Kidney disorders with hypertension, uncontrolled, poor compliance, and any impaired organ function, severely impaired organ function, heart failure, kidney failure, lung failure, neurological disease, your functioning is a major prognostic factor. If somebody is already in a wheelchair, needing help with ADLs, that is a poor prognostic factor for any of the neurological diseases. Be careful of your multi-system diseases, your connective tissues. It's not good enough to exclude arthritis because, for example, your rheumatoid arthritis patients have heart problems. They die of heart attacks. So be careful with your multi-system disease. Be careful to use cardiac markers on its own because of the sensitivity of the high sensitivity troponins. Be careful not to request tumor markers as a screening test. It should be used for monitoring only. For the only exception there is your PSA. Look at your full liver functions, including your proteins and clotting factors when you want to assess liver functions.